Have you been thinking about facial rejuvenation and what it can do for your appearance? Well, we've put together today's presentation to inform you about what you need to know, about what you need to consider before making any decisions about your treatment. Today's presentation is going to arm you with the facts and give you the information necessary to make the best decisions when it comes to your health and your beauty. There's little doubt or argument that our facial appearance is one of the most distinguishing and memorable features of our entire body. Have no doubt about it. Most people aren't going to admit to judging you by your facial appearance alone, but the fact is, a youthful, healthy, and attractive complexion is going to have a significant influence upon how others respond to you. First impressions really are important, and lasting impressions are even more so. And so possessing an attractive, a vibrant appearance and projecting yourself as a self-confident person can be a tremendous asset in both your personal and your professional life. As we age, the effects of our lifestyles, environmental exposures, and time all begin to load up on us and add up on us and end up appearing in our complexions as lines, wrinkles, age spots, loose skin, crinkles, dents, divots, etc. These changes can also include skin texture irregularities, things like acne scarring, pigmentation changes, freckles, sunspots, age spots as some people call them. Even visible blood vessels can end up showing up in our skin. And while there are those who choose to accept this aging process as some kind of inevitable condition of life, there are others out there who are seeking cosmetic relief, people who enjoy a different perspective, many who are looking to recapture their youthful appearances, fight the aging game, and keep looking and feeling their very best for as long as possible. After all, there's no point in accepting unwanted effects of aging if you don't have to. For those of you that are seeking to fight those effects of aging and want to enjoy a more youthful appearance, modern cosmetic medicine offers you numerous options for facial rejuvenation, helping you win the aging game. We're going to talk about some of those treatments, the most popular treatments today, what to look for and what to think about them. Facial rejuvenation is a broad topic, and it's composed of a large group of cosmetic procedures, both surgical and non-surgical, that are designed to make your facial skin and your appearance look younger, look livelier, and more refreshed. Facial rejuvenation consists of cosmetic treatment or treatments designed to bring a more youthful complexion to the human face, to your appearance. Facial rejuvenation, like we said, involves treatments that are surgical or non-surgical. It depends. Skin rejuvenation treatments also vary in the level of invasiveness and in the depth and the longevity of the treatment. One of the first and most well-known facial rejuvenation treatments, of course, is cosmetic surgery. It is always the most radical option for facial rejuvenation. It's the most invasive, it's the most risky, potentially dangerous, and serious of the skin rejuvenation options. And surgery, though it's a radical avenue, also yields the most dramatic results. And sometimes it's the best option or the only really effective option for those with advanced aging symptoms, including extremely loose sagging skin or deep, really advanced wrinkling or damage in your skin. Cosmetic surgery usually includes procedures to remove excess skin, remove fat deposits from facial areas, etc., then stretch the remaining skin, redraping it over the area so it looks tighter, smoother, and giving you a more refreshed, and a lifted appearance. These procedures, though varied, may include facelift, brow lifts, eyelid surgeries, also known as blepharoplasties, chin lifts, nose jobs, which we know as rhinoplasty, neck lifts, etc. Surgery is always going to be your most radical option, with the most serious consequences to be considered, and it might not be right for a lot of people. Surgical dermabrasion is another option, and this procedure mechanically removes the uppermost layers of your skin by essentially either sanding them off or scraping them off in a surgical procedure to produce a healing response in your skin that ends up generating cosmetically superior skin once the process is finished healing. Dermabrasion can reduce scarring, both from acne and for other reasons. It can combat fine lines and wrinkles on the face. It can treat reddening or rosacea in the skin, other pigmentation changes in the skin, including age spots, sun damage, etc. Let's also talk, though, about non-surgical, those less invasive or even completely non-invasive facial rejuvenation techniques. Non-surgical options are plenty, and they have various advantages and disadvantages over the surgical alternatives. Generally, there's less risk. There's usually less in the way of adverse side effects, expense involved, downtime to heal and recover, and pain, much less pain associated with many of the non-invasive or non-surgical procedures. Microdermabrasion would be one of them. Microdermabrasion is surgical dermabrasion's little sister. It treats the skin in a more superficial way, actually involves polishing the skin with fine abrasives rather than entirely removing it. Microdermabrasion removes that topmost layer of the skin. Again, it encourages a healing process that ends up improving the skin's texture and appearance. This treatment is similar to surgical dermabrasion, but the depth of the treatment is far more superficial. Our next class of non-surgical treatments involves chemical peels, which involve applying chemicals to the skin surface in order to end up dissolving the top layer of skin and the dead skin cells that are resting on the skin surface, generally refreshing and revitalizing the skin's appearance. This technique is similar to dermabrasion that we've talked about and microdermabrasion, but it uses chemicals rather than a mechanical system or mechanical mechanisms to end up removing the skin layers. As a result, the newly formed skin is usually smoother, less wrinkled, has a better quality and tone than the old skin that's being replaced. Chemical peels, like we said, are generally a superficial treatment, and they can improve the appearance of mild scarring, acne scarring, age spots, freckles, sun damage, even light wrinkles. Chemical peels are also broken down and classified into the levels of depth that they treat to. There are light, very superficial peels that only remove that top layer of dead skin cells from the surface of the skin. There are also those that treat to medium depths in the skin, and even ones that treat deep into the skin layers. Deep peels exist that can really get down there in the skin deeply, but most of those deep peels, chemical peels today, have been replaced with lasers and laser resurfacing. So that would be our next class, was to talk about laser skin treatments, which there are several of, both ablative and non-ablative. These skin rejuvenation treatments end up using laser light energy to either end up stimulating structures in the skin and producing new collagen, or to actually damage the top layers of the skin or remove those by using light to damage the skin layers and then produce a healing response, much like what we were talking about in chemical peels or in dermabrasion, only we're using a laser now to treat the skin. Treatment depends, of course, on how the laser energy is being used. There are ablative treatments that impact and damage the skin surface layers. There's also non-ablative laser skin treatments where the light energy, instead of being focused on the top layer of the skin, is focused much deeper into the deeper layers of the skin to produce a response. Deep skin treatments leave the surface layers unchanged, untouched, while focusing the treatment deeper into the tissues to stimulate new collagen formation, sometimes called collagen remodeling, and then end up promoting skin tightening as a result of this new collagen formation. We're going to talk a little bit about collagen formation. We're going to talk about what happens to collagen in your skin as it ages and why it is a key in achieving facial rejuvenation. Laser skin treatments are an excellent choice, can be an excellent choice for a variety of different conditions, depending on how they're being used. They can end up evening out skin tone, removing dark age spots, etc., end up reducing light wrinkles, or even deeper wrinkles, depending on how the laser energy is being focused. Then there's also non-invasive radiofrequency treatments. These skin tightening treatments like Pelleve end up treating deep into the skin. Some brands that may be familiar are Pelleve, Thermage, etc. These treatments focus the energy frequency deep into the skin tissues, where they end up heating the tissues, stimulating the formation of new collagen and elastin tissues that end up resulting in a smoother, tighter, more toned skin. We're going to talk about this in just a minute on how this works and why treatments like Pelleve and radiofrequency are really encouraging for the non-surgical, non-invasive route to rejuvenation of your skin. You see, because only energy treatments, high energy treatments like radiofrequency or lasers or even ultrasound can provide really lasting results for loose skin, lasting results for the treatment of wrinkles without going to the more radical cosmetic surgeries to get an effect. These treatments are generally long-lasting. Like we said, improvements can be seen for up to 2 years with some treatments, the average range being more between 6 and 18 months, depending on the type of treatment that you're having. But then the nice thing is with most of these treatments, when the effects begin to dissipate, you can go in and have treatments again, get a tune-up, and keep that facial appearance that you're after. They are, like I said, the most effective non-invasive cosmetic procedures for skin tightening and for facial rejuvenation. Our next class is the injectables and fillers. Dermal fillers, injectables like Botox, fat injections, collagen, etc. are the most familiar in this category. Some of these substances plump up the skin to fight wrinkles, and others go to work at a neurological level, temporarily paralyzing certain facial muscles to end up combating the wrinkles and your expression lines. Botox is an injectable drug made from a neurotoxin called the botulinum toxin. And cosmetically, it's used to temporarily paralyze facial muscles like we were talking about. Those facial muscles that when they contract end up promoting or causing wrinkles. This toxin, this Botox toxin, this botulinum toxin can be injected in very, very minuscule amounts in the specific facial regions where it disrupts the nerve communications, effectively leaving the muscles paralyzed and unable to contract and produce the frown lines and produce the wrinkles that you're seeing. Botox is able to reduce the appearance of some but not all facial wrinkle types. And each unique patient is going to experience differing lengths of effective treatment for how long it's going to maintain the effect. 2 to 6 months is the normal effective lifespan for a Botox injection, with 3 to 4 months being average. Collagen injections. Well, this cosmetic filler is designed to replace or help compensate for lost and aging collagen tissues in the skin that have lost their tone. Collagen fillers were among some of the first injectables on the market used in aesthetic medicine. But what I really want to talk about and have you understand is the effect of aging in the skin, and how collagen is involved in that, and why collagen is so important in maintaining healthy looking skin and in producing facial rejuvenation. You see, your skin is a multi-layered organ that's made up of several layers that covers your face, your facial structures, and your entire body. And just below this uppermost covering, this epidermal covering, is the first layer of skin. And then there's a secondary layer of skin, and that secondary layer, that foundation, is composed mostly of a protein and protein structures made up of collagen. Collagen is a key support structure in this layer, where it creates a network of elastic tissues and fibers that allows for the growth of skin and also its ability to stretch and then return to its original form. But when this collagen layer, this elastin tissue, begins to break down through aging, sun exposure, environmental toxins, etc., ends up losing its elasticity, its healthy structure, and its tone. Aging skin actually begins to break down, begins to have a gradual decrease in the amount of collagen content there and being produced, and the actual collagen network itself becomes disrupted, damaged, and breaks down over time. When this happens, we see these effects of aging. Your skin ages, it becomes roughened, it becomes loose or lax, wrinkled. There may be pigmentary changes that we see, as well as possible vascular changes as well. That's why energy treatments like Pelleve and certain laser treatments are so inviting, because they actually go to work stimulating this secondary skin layer and producing renewed collagen production by using your body's own natural rejuvenation processes, rather than surgically removing and pulling skin or adding fillers into our skin. As new collagen formation takes place, it fills in these old depleted collagen stores in the skin. The skin ends up becoming firm, plumped, refreshed, and it ends up alleviating many of the signs of aging that include wrinkles, loose skin, expression lines, etc. Let's watch this short animated video that shows what happens when radio frequency is delivered deep within the skin to produce a collagen remodeling effect. In this case, radio frequency energy heats the lower dermal layers of the skin, where it produces a reaction, stimulating the collagen fibers, causing them to contract, which is why we can see an immediate effect, immediate improvement in our skin after just one treatment. Then what ends up happening is fibroblasts deep in the skin ends up regenerating new collagen stores, new collagen fibers in the skin. This creates a long-term effect, a lasting effect, where we'll see collagen formation taking place in the skin for as long as up to the next 6 months. We'll see continual improvement. And these facial rejuvenation procedures are just some of the many ways that cosmetic medicine can enhance your appearance, keep you looking younger for longer. There is a plethora of approved treatments available in the area of cosmetic skin rejuvenation, which gives you a multitude of options to battle the effects of aging. Go ahead, contact Bay Area Pelleve today for a professional skin consultation and to discuss your specific needs today. Some of the conditions that can be treated with these skin rejuvenation techniques includes wrinkles, lines, crinkles, etc. Both ones that are visible at all times in your expression and those that are caused when you smile, when you frown, that are expression lines that appear or deepen with certain facial movements and expressions. Other things that can be treated is this loss of skin tone, this weakening of collagen and elastin fibers, or the thinning that goes on in the deeper layers of the skin that ends up leading to skin laxity, the lack of firmness, the thinning of skin that's seen as we age, and the development or the ability to see visible cellulite deposits under the skin. Conditions also treated with skin rejuvenation can include scarring due to acne or injury, surgeries, etc. Pigmentation changes, discoloration of your skin, dark patches, freckles, sunspots. Vascular conditions, the appearance of visible blood vessels on the surface of the skin or just underneath it, spider veins, constant facial redness, etc. So when we're looking at it, we're looking at choices. We're looking at invasive surgical procedures or non-invasive procedures that are available. Cosmetic surgical procedures have been the standard for years that all other skin rejuvenation processes are measured and judged by. Surgical procedures by far generate the most dramatic effects when it comes to facial rejuvenation. They're sometimes the only really effective method to turn back the clock in cases of advanced conditions. Unfortunately, surgery also comes with significant risks and other factors that must be considered. Some of those factors include possible side effects, post-treatment downtime can take weeks, and recovery pain, recovery expenses and lost wages, time off, and the expense of the procedures themselves. And there's also emotional and mental preparation when it comes to cosmetic surgery that may be involved. Some people just aren't ready mentally, emotionally, or financially for such radical procedures, nor do their symptoms always necessarily warrant them. A lot can be accomplished with non-surgical and non-invasive procedures. Many new alternative technologies and techniques are being developed and being used today to rejuvenate skin, all with minimal downtime, minimal complications, risks, pain, and with no surgery. As the technology has advanced, results and options have grown. So has the interest in these non-ablative, non-surgical alternatives to the point that they now outweigh those of surgical techniques. These alternative modalities are all designed to produce a variety of cosmetic benefits. We've gone over some of those, including the improvement of wrinkles, skin looseness or skin laxity, skin texture problems, tone, and overall appearance. And these should all be considered before committing to any prescribed treatment for facial rejuvenation. There are a lot of options out there for you. Generally speaking, good candidates for minimally invasive techniques are going to include those who have mild to moderate symptoms of aging. These are going to include patients with fine to moderate lines, wrinkles, loose skin, or other possible symptoms from aging, sunspots, etc. These are going to be the patients that see the best results with non-invasive modalities. See, it's important to consider and to understand that with non-surgical alternatives, your skin issues are going to improve, but they might not be fully eradicated. Another aspect to consider is that the aesthetic benefits from treatment are most often going to occur gradually over time, like we talked a bit about with collagen remodeling, where collagen is actually being rebuilt in your skin with several treatments over time. And so they're far less dramatic and immediate than with those you're going to see with cosmetic surgeries. So when should you consider facial rejuvenation? Well, when you want to limit or reverse the signs of aging in your life, you want to restore a more youthful and radiant appearance to your complexion. Or when you're seeing wrinkling, crow's feet at the corners of your eyes, fine lines or folds around your lips and mouth, frown lines, or permanent expression marks. When you're experiencing bags under the eyes, when you just don't look rested, there's permanent dark circles appearing, or there's pigmentation changing, redness, age spots, etc. When you're beginning to appear tired all the time, and when you want to appear more refreshed, more vibrant, healthy, energized in your appearance. When you have loose, sagging skin, when your skin is thinning, or your skin symptoms, your appearance is becoming a distraction to you, either to your beauty or to your self-esteem. These are times when you should think about and consider facial rejuvenation options for you. So where do you begin then? Well, there's various treatments available. And to find out what procedure is going to work best for you, or what combination of treatments can work best for you, go ahead and contact Bay Area Pelleve. Contact a local provider or your doctor. See your doctor or your dermatologist for a professional skin care consultation. And when you're ready, contact Bay Area Pelleve. Let us get you set up. Start looking and feeling your very best again. Capture the essence of ageless skin with facial rejuvenation. Lift and tighten your skin. Reduce wrinkles and fine lines, all without painful procedures and downtime. Contact Bay Area Pelleve today. See what these non-invasive treatments have to offer for you in the way of facial rejuvenation today.